The Centers for Disease Control and Prevention, the CDC, have looked at a large number of pregnant women who were found to be infected with Zika virus during pregnancy. And in the United States, pretty much all pregnant women are being screened, meaning asked, have you traveled or has your sexual partner traveled during the time of pregnancy. And so we have a decent sense of who has had this exposure. This new epidemiologic data from the CDC really helps to quantify what the risk is, and that if a pregnant woman is infected with Zika virus, there's about a 10% chance that the child will have some sort of birth defect, most commonly microcephaly. 10% is a very high number, and it really stresses the importance that pregnant women not travel to Zika virus endemic areas, and that if people are traveling to areas where Zika virus is endemic, that they wait at least 8 weeks if it's a woman, or 6 months if it's a man, before trying to conceive a child. This 10% value seems to be very real, and it really puts a number to what was previously an obscure concept of risk. I think the take-home point from this is that pregnant women should defer travel, if at all possible, to Zika virus endemic areas until they are no longer pregnant. And if a couple is thinking about having a child and is traveling to a Zika virus endemic area, that they wait at least 8 weeks if it's a woman who has traveled, or 6 months if it's the man who has traveled, before trying to conceive a child. I think this is an important piece of information in terms of the epidemiology of Zika virus infection and what the implications are. Previously, we knew that there was a risk of microcephaly or other birth defects associated with infection during pregnancy, associated with the unborn child, but we didn't really have a number with that. We didn't know, of the people who travel, how many are going to get infected with Zika, and of the pregnant women who are infected with Zika, how many of those unborn children are going to have some sort of birth defect. And now we have a better sense of what that actual number is, and that of the pregnant women who have laboratory evidence of Zika virus infection, about 10% of those children will have some sort of birth defect associated with it.